We go now to our reporter Laura Windsor with a report on healthcare safety.
It has been estimated that over 5 million healthcare workers are potentially being exposed to hazardous drugs in the workplace in the United States. We went to Karmanos Cancer Center, a designated comprehensive cancer center in Detroit, Michigan, to find out about a new device they currently utilize that protects patients and medical professionals from hazardous drugs. We asked Stephen Smith, the Executive Director of Pharmacy Services, to explain how this device is used.
People think cancer is one disease, and cancer is actually several thousand different types of diseases. So the drugs that you receive for a particular cancer are varied. When I started practice 30-some years ago, we had probably 30 drugs. And now we have over 400 drugs, easily. And you use various combinations, different doses, different timing, in combination with surgery, in combination with radiation. All these entities are used together to treat the patient's very specific type of cancer. A hazardous drug would be a chemotherapy drug. That drug can cure cancer, but in some cases it can also cause cancer. So you want to limit exposure of hazardous drugs to healthy human beings.
Over time and being exposed to the different hazardous drugs, there's an increase in adverse health effects such as infertility, birth defects, miscarriages, and even lead to possibly cancer.
Hazardous drug exposure is a hot topic today. At this facility is we take it very seriously, and any time that we can minimize that exposure to our technicians, that's a good thing. And part of that is we utilize closed systems here, transfer devices. It minimizes the amount of exposure to everybody involved. That's whether the technicians are involved, nursing staff, patients involved, and patient loved ones as well.
Equashield is a closed system transfer device. It's a device that we use on syringes to move medication from vials into, say, IV bags for patients to receive. Anytime you puncture a vial to pull medication out of that vial, there's very minute aerosolization. In other words, the drug goes into vapors and actually comes out of the vial. And so you want to use devices that minimize that even more so than our standard of practice.
Equashield is used in the pharmacy to draw up the drug and prepare the drug for the patient, and then the nurse uses that component as well to administer the drug to the patient, and then it's also sealed and contained all the way through disposal, so that way you're protected from preparation to administration and on to disposal.
Physically, it is very similar process-wise to using a regular syringe. You just use the adapters to access the drug vials. The syringes click in very nicely. It's easy, it's red to red, it's easy to remember. You withdraw whatever contents that you need for that patient for the appropriate dose, and then you administer it to the IV bag, which has an adapter on it as well.
The other aspect of Equashield is that it prevents any sort of microbial contaminants from entering the system. So you have chemotherapy patients that already have a weak immune system, and that's a further risk for them to have any sort of microbial contamination. So the system is protecting the healthcare worker during the preparation and also protecting the nurse during the administration side of not allowing any sort of vapors or aerosols to escape, but it also allows nothing into the system, so you have these chemotherapy patients that are protected from that as well.
My colleague and I, Mark Slatsky, recently conducted a study here at Karmanos Cancer Institute comparing closed system transfer devices used on traditional hospital syringes versus the Equashield syringe.
And we found in our study that the Equashield product minimized, or actually there was no contamination whatsoever in the barrel itself on that syringe as opposed to the competitor.
Being a comprehensive cancer center, we have 12,000 new patients per year within our system. And treating a large amount of their treatment is chemotherapy. So our employees make a lot of chemo. We're typically within a month somewhere between 3,500 to 4,000 doses plus per month. And so that's a lot of potential exposure of employees to chemotherapy. So that's one of the reasons we conducted this study, one of the reasons we're so focused on patient safety, employee safety, because just the vast amount of chemotherapy we do compound on a daily basis.
Implementing this new safety standard in the work environment will help protect patients as well as healthcare workers from any hazardous contaminants. For the American Health Journal, I'm Laura Windsor.